When we think about climate change, our minds usually jump to melting ice caps or distant polar bears. But what if I told you the most immediate, most urgent frontline is actually our own health? That's the core argument of the COP30 Special Report on Health and Climate Change. It's a landmark document that completely reframes the climate crisis as a health emergency that we have to deal with right now.
So, here's how we're going to break it down. We'll start by digging into this unseen emergency and see how it's putting our entire health system under incredible stress. Then, we'll look at the solution, the Belém Health Action Plan. We'll explore the proven actions it recommends, the roadmap it lays out for leaders, and finally, what the report calls the ultimate prescription for a healthy future. Okay, let's get right to the heart of it. The report's main message is crystal clear. Climate change isn't some abstract problem for future generations. No, it's a health crisis that's happening today, affecting our bodies, our families, and our communities right now. And we're not talking about hypotheticals. I want you to look at this number. 90,000. That's the potential number of people in Europe alone who could die from extreme heat every single year if we hit 3 degrees of warming. This shows just how directly climate change becomes a real physiological threat to human life. And this leads to a really dangerous paradox. The very systems we built to protect our health, our hospitals, our clinics, our supply chains, they are themselves incredibly vulnerable to the climate crisis. They're supposed to be our shield, but they're also a primary target. And we're already seeing these defenses start to crumble. Think about this. During a heat wave in 2022, the IT systems in major London hospitals literally overheated and crashed, delaying patient care. In Malawi, cyclones are putting the cold chains for life-saving vaccines at constant risk. But maybe the biggest issue is one of profound inequity. The report is very clear. The people who've done the least to cause this crisis are the ones suffering the worst health impacts. And this isn't just about building stronger walls or buying better tech. The report is absolutely unequivocal here. You cannot have climate resilience without climate justice. If we don't fix the underlying inequities that make some communities so much more vulnerable, all our other efforts are, frankly, doomed to fail. Okay, so if our systems are at risk and inequity is a massive part of the problem, where do we go from here? Well, the report doesn't just leave us with the problem. It proposes a solution, the Belém Health Action Plan. It's a global strategy designed to turn our health systems from victims of this crisis into pillars of resilience. Now, the BHAP isn't just a list of nice ideas. Think of it as an operational framework, a super practical roadmap that's packed with proven, high-impact actions that governments and health organizations can start using today. It's all about moving from research to real-world, life-saving action. So, what does this plan actually look like in practice? The report is full of proven actions. And these aren't just theoretical models. These are tested, scalable solutions that are already out there protecting lives. The whole plan really rests on 3 main pillars. First, building resilient infrastructure. That means making our hospitals and clinics both safe and green. Second, using climate-informed data to build early warning systems so we can act before disaster strikes, not after. And third, empowering a climate-ready health workforce, giving them the skills and knowledge they desperately need. And you can see this working in the real world already. Look at the Caribbean's Smart Hospitals initiative. They retrofitted facilities not only to withstand hurricanes, but also to lower their energy costs. Amazing. In Ahmedabad, India, a heat action plan is estimated to have saved more than 2,300 lives in just 2 years. And in Malawi, simple solar-powered vaccine fridges kept critical supplies safe when the power grid went down. These are the kinds of brilliant, high-impact solutions that are ready to go global. Now, empowering the workforce isn't just about more training in a classroom. It's about totally breaking down silos. A resilient health professional in the 21st century needs to understand how the energy grid, how transportation, how food systems all connect back to a community's health. It really requires a fundamental shift in how we think. But we have such a long way to go. A survey from 2020 revealed something truly staggering. Get this. 85% of medical schools around the world did not include climate change in their curriculum. We are literally sending our future doctors and nurses to the front lines of a health crisis without the basic training they need to face it. So, how do we fix this? How do we close that knowledge gap and actually get these solutions rolled out everywhere? Well, the report lays out a very clear roadmap for leaders, and it focuses on the 2 things that make everything possible:
governance and finance. The mandate for leaders is pretty straightforward. First, they have to anchor climate and health goals into national law, make them real, make them permanent. Second, they have to force collaboration between ministries. The health ministry can't do this alone. They need finance, they need energy, they need everyone at the table. And third, they have to unlock the money needed to make all this happen. And that brings us to the biggest bottleneck of all, finance. The report shows this massive chasm between what's needed for health adaptation, we're talking over $300 billion a year, and what's actually being invested, which is just $26 billion. That gap is enormous. Closing it is one of the most urgent challenges we face.
But here's the thing. Even if we had all the funding in the world, and even if we implemented this plan perfectly, the report brings us to one final, really sobering conclusion. It forces us to look at the hard limits of what adaptation can actually accomplish on its own.
And this leads us to the report's ultimate conclusion, maybe the most important sentence in the whole document. The single most effective health intervention isn't a new vaccine or a fancy hospital, it's stopping the warming in the first place. Why? Because no health system on Earth, no matter how strong or resilient, can adapt to a world of runaway climate change. Adaptation without mitigation is, quite simply, a losing battle.
So in the end, the report concludes that the most powerful prescription we have isn't a pill or a medical procedure. It's rapid, deep, and sustained decarbonization across every single part of our economy. The health of every person on this planet is the most powerful and compelling argument we have for bold, ambitious climate action.
Ultimately, this report isn't really a document of despair. It's a call to action. It's a plan. The evidence is there, the solutions are there, the roadmap is clear. So the question it leaves us with isn't what we should do. The question is, do we, as a global community, have the collective will to actually get it done?